everyone. Thanks so much for joining us today. Happy summer to everyone. We're thrilled to be here today to talk about coalition building, and glad you joined us. My name is Rochelle Seeger. I'm honored to work here at the Foundation for a Healthy Kentucky. My official job title is the Community Health Research Officer, and I work on a lot of things, including this training series that we fondly call Health for Change. I work on the Foundation for Healthy Kentucky's annual health issues poll that we call KHIP. That's in partnership with Interact for Health, a health foundation serving the greater Cincinnati area. And I also work on a lot of different data and report writing for the foundation, including the data website Kentucky Health Facts. Also on my list of things to do is updating our Kentucky Health Coalitions directory. So right now, if you check out our website, healthy-ky.org, and you use that search box to look for coalition directory, you'll find a directory from 2016. So many of you may have already filled out the SurveyMonkey to update that for new 2019 information. So I'm excited to work on all of those efforts for the Foundation for Healthy Kentucky. The Foundation was founded in 2001, a nonprofit, nonpartisan organization with a mission to address the unmet health needs of Kentuckians. And that photo I took just earlier this month in Whitesburg, Kentucky at an event we held there in partnership with the Kane Kitchen. The Foundation's mission is accomplished by developing and influencing policy, improving access to care, reducing health risks and disparities, and promoting health equity. This training series that we're all on today, we fondly call Health for a Change. And it really grew out of some of the Foundation's work with groups just like yours who are applying for grants and doing a lot of work in our state to improve health. And people were looking for supports like this, a webinar or a workshop where they could learn about grant writing, coalition building, health data, and a variety of other topics. So Health for a Change was begun in 2001. The website at the top, healthy-ky.org, Events tab, and Health for a Change, you'll find all of our archive of past events, including recordings of webinars and slide decks. So as our operator mentioned, this webinar is being recorded, and the slide decks will be available possibly later this afternoon or tomorrow. So everyone will have access to those. Some upcoming events that we have on our schedule. July 17th, please join us for a webinar on data visualization. 2017 Adobe Creative Fellow, Jessica Bellamy, will present on that, and I'm thrilled to have her on our webinar on July 17th. And she'll return for an in-person workshop we're going to hold in Louisville on August 2nd. So those are two not-to-be-missed events. And finally on the schedule so far for the remainder of 2019 is on July 24th. We'll be in Scottsville for our coalition workshop there on Need More Acres Farm. So that's going to be a super unique event down in the Bowling Green area. Final announcement I want to make before we get started. We're being recorded, as you know. You can chat in questions to us if you're logged into the computer via the chat box. So if you have any problems with the logging in or you have a question for our presenter or me, please feel free to chat us there and we will get you an answer. Final announcement. I also coordinate Data Forum that we hold every other year in Northern Kentucky. This year it's scheduled for Friday, November 15th. We'll be in Erlanger. Have a great lineup of speakers for that conference event, and that is co-sponsored also with Interact for Health there. So save the date and join us up there in person on November 15th. I'm going to go back in time to around 2008 when I met our speaker out at a health fair in our community, and we got to talking, and I am thrilled to have her here on our webinar today because I know she's done a lot of work in the space around coalition building. And now I'm going to turn the call over to our speaker today, Sivan Edwards. Welcome, Sivan.
Greetings, everyone. I hope that you can see me on your screens. I like to have these webinars a little more interactive because we all know that we can get to doing other things while we're on the webinar. And I really want you to get something from this as if we were live with each other. So great afternoon. Be prepared to respond to several polls and questions throughout this webinar as well. So a little bit about myself. I have 10 years of proven experience in the nonprofit and government sectors. I started my work in public health in college, actually, working with the Minority Association of Pre-Med Students, bringing together organizations in public health and as well as the medical community and making sure that gap was bridged and making sure those sectors interacted for the health of the greater good. Many leadership positions, such as board membership, worked on several evaluation programs, local and federal, and then of course coalition building, which has been the most fun of my work so far. And the largest coalition projects I have worked on, and I'm coming from a Louisville lens just on this piece, however, we will be discussing concepts that cover across urban and rural areas. But the largest coalition projects that I have been able to work on have been Healthy Hometown Movement as well as Healthy Babies Louisville. The Healthy Hometown Movement was organized around several different health issues. There were about 4 different health foci, and partners were collaborating on raising awareness and then also establishing programming. Okay? With Healthy Babies Louisville, partners came together for one focus, which is to reduce infant mortality and also work on policy change. Not necessarily instituting new programs, but working on changing systems and policy. And so I'll be referring to those two throughout the presentation, but I also know that there are several others that we should mention and should talk about as successful coalition models here in Kentucky. Rochelle, could you name a couple of those coalitions around Kentucky that we may want to refer to today?
Sure, thanks, Sivan. Two that I'm involved with and know of are, for you here. One is called the K-SPAN. So that's a, I see some K-SPAN people on the call here. That's the Kentucky Safety and Prevention Alignment Network. And so that network is a network of public and private organizations, individuals dedicated to promoting safety and preventing injuries throughout the Commonwealth. I believe, you can check out their website, safekentucky.org, that they're funded in part by a CDC grant. But what's exciting for me is that they have quarterly meetings where a lot of information is shared, and people who are working in the space of Safety and Prevention Alignment Network can meet and share information. So that's what I love about the K-SPAN network. The second coalition I want to mention is the BRIGHT Coalition. So if you're work on coalitions in Kentucky, you may know of them. They're in the Barren River Ad District, a well-established coalition with board of directors and bylaws. So definitely aspirational, and I know they're doing great work. Their vision for the BRIGHT Coalition is every resident in the Barren River Area Development District have the best quality of life possible by ensuring a safe place to live, work, and play. And they're at brightcoalition.org. So those are two that I think about when I think of coalitions. But I know that lots of people are doing really good work across Kentucky on the ground. So that's what's so exciting for me to be on the call today.
And to that point, please submit to us what is the purpose or goal of your current or future coalition, and send us your location. And we'll give you a little bit of time to submit that information. Great, we have Cincinnati on the line. Awesome. Murray, Kentucky. Great, environmental education in Clark County. And then we have recreation education. I did some of that work as well. That's always fun. Oh, great. Advocacy at the state and federal level. Awesome. So we have a really great mix of folks in the room. That's wonderful. Okay. So I also want to, if you haven't been able to share that, that's fine, because I also wanted to skip to this question here of what is your coalition's age? I want to know what phase folks are in as they do this work. Okay, great. So folks are in the beginning phases, and we have some really great veterans on the call. Awesome, awesome, awesome. And then I also have another question. I told you it would be very interactive. I also have another question here that asks which sectors are involved with your coalition, or do you plan on involving with your coalition work? And you can check all that apply. Oh, someone says all of them. Great. That's good systems thinking. Okay. Good. We have some folks on the webinar thinking about housing. Very important. Yes. Good, good, good. Okay. Wonderful. So we have a really great mix of multi-sector coalitions on the call. So what I want to do is actually talk broadly about the basis for a coalition. So what I have learned is that there are two bases for a coalition. One is interest or economic base, and another is identity. So when we talk about interest, because sometimes interest and identity can be confusing terms to use together because we often think they mean the same thing. In 1983, Bruce Yandel is an author that developed the Bootleggers and Baptist political model, and I figured this was appropriate for our state, in which the opposite moral positions lead to the same vote. So the policy was that liquor could not be sold on Sundays. And the Baptists said, yes, we agree with that. And so did the bootleggers, because then they could sell their liquor on Sundays because the stores were not open. So it takes that complementary common interest to form a very strong coalition. Both of them had an economic stake in the outcome of the movement, whether it was moral or whether it was economic. So that is a really great example of an interest-based coalition. But we also have identity. Now with identity-based coalitions, folks often sacrifice the economic for the principle of it, right, for these other objectives. And so it's the coalition that is there because a response is needed to a problem, a response is needed, a solution is needed, and we are there just because we are personally invested in the solution. No one gets anything out of it monetary, okay? No one gets anything out of it. They probably might not even get anything out of it as far as raising awareness about their own organization or their own mission, but they're in it because it is right, okay? Now appealing to the self-interest or the economics means the coalition pool is broad because everyone wants to get something out of it. And you can bring anybody in as long as you can prove that there is economic interest. However, it means that your ties are weak. If somebody's not getting anything out of it, then they are not going to be in for the long haul, which often our coalitions are in for the long haul. So those relationships are relatively shallow. Alternatively, if you appeal to identity, you will have very strong allies, but your pool will be quite limited because your focus is narrow, and also because the benefit might not be seen by a large group of people. So considering those two examples there, what I wanted to ask is which of those types of coalitions do you believe would best fit your needs? So take a moment to think about that, and I'm going to pose the question of which of these two coalition types do you think would best fit your needs? Interest-based, which is usually economic interest, however the goal is the same, or identity-based, where there is no economic interest, but you have a limited number of people that you'll be able to work with because it is so specific. Okay, we're about half and half. We're about half and half. Well, I'm going to tell you about, talk a little bit about the case studies that we mentioned or the coalitions that we mentioned earlier. With Healthy Hometown, it was really identity-based, okay? Very identity-based because folks identified with the need to address different health issues. They did not necessarily get anything economic out of it at first. There were Healthy Hometown grants, but none of the organizations were guaranteed to receive that funding. However, they did decide to come together in order to make a change, whether that's starting a program, whether that's making sure that there was access to fresh food, making sure that there was limit on tobacco use. They all came together because it was right. Now, in the case of Healthy Babies Louisville, it's twofold. It is economic-based because several of our partners at the table in Healthy Babies Louisville, with the goal to reduce infant mortality, see a reduction in infant mortality as a cost-savings initiative because infant mortality was costing them a lot. We had hospitals at the table, right? There's lots of inpatient service costs associated with that. We had health providers at the table, frequent visits, those types of things, those types of long-term health issues that come from dealing with infant mortality and low infant outcomes as far as low birth weight, etc. And then we also had community partners at the table that still even came together for interest because they knew that it was right. These initiatives that the coalition was working on were the right way to go in order to ensure the outcome. So we were split in half with interest and identity-based. So that's very interesting. Now, here's the thing. Neither of them is wrong, right? You just have to know which type is going to lay the basis for how you recruit to your coalition. So we're always going to have one of the two or a combination. So these will frame how you recruit to your coalition. And so now I want to flip and talk about power models a little bit because in every coalition, there's absolutely power models. So you have the balance of power. And this is very interesting. You see this in collective impact where there is a backbone agency that leads smaller organizations, smaller and larger actually, toward the common goal, okay? More than likely, it's probably an organization that has the resources to be a backbone agency, which means they have the staffing. Those are coalitions. We know we need staffing. They have the capacity, and they may have funding in order to host events, in order to host meetings, purchase lunch, that type of thing. So that's what you see in a balance of power type of relationship. You can also see it where the power shifts between organizations because one organization may lead, it may shift to another organization, but there's still a balance of power there where everyone is giving and everyone is contributing. And when you talk about collective impact, the former director of the Center for Women and Families described it to me in the best way. It's like a flash mob. So in a flash mob, you don't necessarily have a leader, right? Everyone learns in the background, and then when you come out and do the routine, everyone is moving the same way. No matter their body type, no matter what clothes they're wearing, no matter their race, age, gender, everyone is moving the same. So that's similar to how a balance of power type of coalition operates, and that every organization is moving the same in the capacity that they do have. Now, the other type of coalition is bandwagon. The other type of power structure is bandwagoning. So that is the, we've heard of bandwagoning before, but that is actually where within a coalition, smaller organizations are vying, actually competing with each other to be the best partner for the strongest organization within the coalition. So they are not necessarily working together, even though the goal is supposed to be the same. They are not necessarily working together, but rather they're vying against each other to try to work with the coalition that has the greatest strength, the greatest resources, the greatest budget. Okay? So the next question that I wanted to ask you all after discussing these two power models of organizations is, which do you think applies to the case studies? So considering balance of power and bandwagoning, and considering Healthy Babies Louisville and Healthy Hometown, you can choose either one that you want to respond about. But do you think the power structure is balance of power, or do you think it's bandwagoning? Okay, we have a lot of balance of power responses. Okay. Okay, so I will say in response to the responses that I have received, being within both of those coalitions and having that direct experience, I will say that Healthy Babies had more of a balance, or has more of a balance of power model to it, and Healthy Hometown actually has bandwagoning. Yes, somebody answered bandwagoning. It's not necessarily a bad thing, but it's rather that there was a large organization, which was the health department, that was leading this major charge. And many of the organizations that decided to join the coalition did not have the structure that they have now. Many were just forming. Several were very young. And see, that was a clue that I did not give you earlier. And so it was really a matter of bandwagoning with the larger organization. Now, they weren't necessarily vying for the best spot, but rather that's how they came into the coalition, and that's how the power structure remained in the beginning. And then eventually it led to balance of power as those organizations matured. Very good observations, everyone. So now we have maintaining engagement, and I wanted to spend about a majority of time and also give you all time to ask questions regarding maintaining engagement, because we know that in coalition building, it's great to do a project together, very short-term project, a year, some months. But when you're really doing coalition building, you are asking your partners to stick around for 4 or 5 years. And you're asking them to give their time, which is a resource that does have a cost. And you're asking them to stay with you through attrition. You're asking them to stay with you through budget cuts. You're asking them to stay with you through various situations that can happen in the landscape of public health and in what we do over a course of a long time, okay? So in order to maintain engagement, you have to know the goal. Don't start the coalition and don't let anyone give you the urge to mission drift after you have established your goal, and let that be very clear. Let your branding be very clear, because that is the only way that you're going to maintain those who have started with you from the beginning, but also get new members during your coalition building process. And know whether or not it's program-based or if you have systems change involved. Now, currently, public health coalitions are moving toward policy change. They're moving towards systems change because we know that programs are great and everyone gets grants to do programs, and programs are fantastic, but we need to go upstream. Remember, we need to go upstream, and we need to solve the problems that are causing the problem in the first place. And so working on systems change is often where many are going. So if you have not yet started talking about systems change, what it looks like at the state level, what it looks like in your local government, what policies are keeping your coalition partners and your agency from having the best outcomes. If everyone's mission is that you stop smoking, what are the policies that are in place that are enabling that problem to happen? What does it have to do with housing? Does it have to do with mental health? Are those partners that should come to the table in order to solve this problem at the upstream level? And then also maintaining leadership is very important. So within a really great coalition model, you do have a set leader. Now they don't have to necessarily be the spokesperson, but you do have to have a leader that is responsible and accountable to ensuring that there is communication, to ensuring that everyone is acknowledged for the work that they have done and for what they have given to the coalition. You have to have a leader so that everyone knows who to go to for what. And that's just the basics. It doesn't have to be a flashy person. It does not have to be an elected official. Those are really your spokespeople that you're using to market the goal of your coalition. But internally, you need a leader, someone who's going to be responsible. And so we've also moved toward paying attention to equity, making sure that there is a theme of equity in your coalition building. So as soon as you know the goal, you know the problem that you are going to solve, and while you are figuring out ways to solve the problem, you have to recruit from the community. Often we recruit agencies, yes, and that is something that was used in the Healthy Babies Louisville model, was to recruit agencies. However, in the Healthy Hometown model, there were also neighborhood folks at the table. And they were asked, what is the solution to the problem? This is the problem, but what is the solution? And there is a best practice of having your agency leaders at the table with the neighborhood. Have them at the table with residents that are affected. Have them at the table with residents from other counties that are affected if you're working on a statewide level. Making sure that there is a voice from the actual people that will be impacted by whatever the outcome of your coalition is. And so you have to ensure that the community is recruited. Actually knowing who the community is very important as well. What are the demographics of the community that you're trying to impact? Are there more women than men? Are there more children than adults? Are there more of one ethnicity than another? Are there people who live more in the rural areas or in the city or in town that will be affected by what we're doing? They need to be at the table. And yes, children can be at the table. You have to be able to be ready to handle that capacity of having children at the table and learning those techniques of how to engage children, which I can provide after the webinar, several techniques for engaging youth within your coalition. But it is always best practice to have everyone represented that will be impacted by your coalition. So in addition to that, making sure everybody has a seat at the table, which I covered a little bit. Actually having the table with agency leaders and those who are funding your coalition and making that work happen, and having residents and those who represent the people at the same table. And then valuing all knowledge. So don't invite children to the table if you're not going to take their opinion seriously. Don't invite the neighborhood to the table if they are not going to have a leadership role. It's very important to cultivate all voices within a coalition, and that is how you maintain engagement. If people do not feel valued, and if they feel that their knowledge, which does not have to be book smart, but it can be experience, and it can be point of view. If they do not feel that those are valued, then they will leave, and other coalition members will also notice that the engagement is not balanced, and they will also leave the coalition. So that's very critical to remember moving forward. And so I have another question for you. And that question is, how many members are you working with that are not affiliated with an organization? So how many are residents? How many are children? How many are folks who are at the table because they have a vested interest? And feel free to answer 0. Awesome, we have 30 high schoolers. Great, great. Someone said 4, good. Okay. 4-ish. Okay. And when you talk about a consortium level, someone answered a consortium level. One thing that we challenged within the Healthy Babies Louisville model, which was made up of agencies, was that they bring with them a client or a community member that they impact on a regular basis and just invite them. We had mild success with that, but we are still challenging our agency partners to value community input into the coalition decision making as well. So that's also a strategy, is to challenge your coalition members, bring someone with you that you impact on the regular basis so that they can hear what we're doing and give us some insight as to how we are moving. Great. So several of you all are trying. That's awesome. That's awesome. And the next question I wanted to ask is, what will valuing knowledge look like in practice in your coalition, or what does it look like? How do you actually value the knowledge of agency CEOs and executive leadership, as well as your residents and clients that are at the table? So what does that actually look like in practice? Or what will it look like in practice if you've not done that yet? Great. Focus groups, resident interviews, awesome. Asking residents for their opinion and what they're passionate about, sharing our story, yes. An opportunity to share at the table. If they want to be included on the agenda, yes, that's a wonderful answer. Having a space on the agenda, that's good. Yes, looking to community members when making decisions. Okay. Awesome. Wonderful, wonderful, wonderful. Now, I do have a question that has come in asking me to define several of the terms that I have used, and one of which is mission drift. So when we were talking about knowing the goal, mission drift is what happens when everyone gets really excited about something that wasn't originally what you had set out to accomplish. And we get all excited about it, and we get distracted. It's the squirrel. I forget what that, the ADHD squirrel. Squirrel. And we get very excited about it, and we tend to get distracted from what the actual goal is. We get excited about this new thing. It becomes a trend. We get excited about trends, and we lose focus on what the original goal is. And so that's how your mission can drift. It also can happen when agencies come in that have more power than others, right, and may have a louder voice and can shift the group toward focusing on something that better benefits them. So you have to watch out for those types of situations in order to avoid mission drift. And I was also asked to define upstream. So there is an analogy, or a metaphor rather, where the problems in public health, the problems that we see are symptoms, okay? And what it is that there is a river, and you all may have heard this before, but there is a river, and you notice that all these babies are floating down the river, and no one's catching them. there's a waterfall at the other end, and they're going off the waterfall, floating down this river. And you're like, oh my goodness, what is happening? So one person in the group tries to start grabbing babies, but they can't grab all the babies because there's so many babies coming down the river. So you get the idea in your head, well, let me find out how the babies are getting into the river in the first place. So that's going upstream and figuring out what the problem is and solving it from there before the babies get into the river. And so that's the upstream terminology that I was using. I was also asked to define systems change. So when we discuss systems change, we are not discussing starting a new program. That's not what that means. Let's take farmers markets, for example, which I love and which I most wonderfully support, and I worked on them for 4 years actually. And a farmer's market is wonderful. It creates an access point. It creates an access point in a neighborhood that has limited means to fresh food. However, it is not changing the system of why there are limited means in the first place, which may have to do with zoning. It may have to do with housing. It could also do with, it could also be related to economic development. It could also do with household finances and socioeconomic status, because people don't have transportation, therefore they can't get to a certain place. But rather, all of these components could be contributing to the fact that there is not an access point for fresh food in a neighborhood. So how can we address those to ensure that there is a store built, to ensure that the store that is built is having fresh food available and not just food that rots or food that is unhealthy, such as convenience food and packaged goods, but rather looking at the entire system on what needs to change in order to make sure that access point is sustainable. And looking on the other side, what is it that farmers need? If a farmer's market is the access point that we want, how can we make it a sustainable access point that's all year round and not just the summer, and that is sustainable for the suppliers as well as the consumers? And so that's what we mean by systems change. So let's look at maintaining engagement again. And so an end beyond the means. And so when I say an end beyond the means, I mean that we are often working without a budget. So we are aiming toward an end beyond our means. So how do we keep going? Like I said before, stay focused. Avoid mission drift at all costs, but look at overall benefit and overall contribution. So in some coalition models, every organization is giving something. No matter if they are the stronger organization or a weaker organization, everyone is still giving something. They're still doing something. They may be changing a policy within their four walls. They may be the agency that's also providing lunch. They may be the agency that hosts the meetings. They may be the agency that sponsors the festival. They may be the agency that has really great marketing and decides to donate their channels to you in order to get the word out about your coalition. So it's a matter of pooling together everyone's resources, no matter what they are, to ensure that the coalition continues. And then I also have down promises. So there is a more formal way, and when you mentioned this about Bright Coalition, Rochelle, having a board of directors and bylaws, within the Healthy Babies Louisville Coalition, we actually had agencies fill out public promises, and we called them public because we posted them online. And they were declarations of what the coalition members said that they were going to do. And we kept track of when they got it done. So there's also accountability involved. And so whether or not that's, well, we are going to be at the table in this capacity, we are going to be at the table in this capacity, they were able to announce that to the group and as well as to community members so that everyone is knowledgeable, that everyone is giving. Okay? And those can be formal or informal agreements. We just decided to do it more formally because we wanted the community to know that these are the changes that will be made, sustainable changes that were going to be made. And we want you all to, since they will be changes that affected you, to know what they are so that you can know what to expect when you go through the four walls of an organization or when you walk around the neighborhood and you see the evidence of what the coalition has accomplished. And so, of course, communications and clarity is important. Emails are not enough. Emails are not enough. You will have to make telephone calls. The definition of coalition, if you all remember your Latin roots, I took Latin roots in school. That had to be a long time ago. But it actually means to grow together. So relationship building is essential to coalition building. So that means you're going to have to be on the phone, actually calling people to remind them about meetings, calling people to invite them to meetings, calling people to remind them of their responsibility, what they said they would do, regularly posting the successes of the coalition. Oh, today organization XYZ got this grant. Wonderful. Today organization XYZ opened doors to a new program. Wonderful. Making sure that there is consistent communication, celebration within the coalition so that it feels like there is a relationship there. Because like I said, it's the long haul. When coalition building, you're asking people to give you 5 years, 4 to 5 years to really see a difference, because we know that our public health statistics take 5 to 6 years in order to really see a change, right, to be statistically significant. So we're asking for a long haul. So it's very important to build those relationships. Also, you can begin using technology to communicate in another way, not just email, but through project tracking software. And I do want to bring this up. There are several different platforms that are free. One is Trello.com, and I see some of the folks that I know on here that are in the coalitions that I've been in, and they know how I am about Trello. But there's also Basecamp.com. There's various different types of project tracking software that can be a more formal way to track the progress of your coalition, of each committee meeting. What are the outcomes? Because we often meet and then we just meet. But what are the outcomes of your committee meeting? Who are you calling next? Who are you inviting to the meeting next? Who are you going to write a letter to? Which elected official are we reaching out to this month? And just keeping track of those things, because they can often get unwieldy with very large coalitions. If you're working in a coalition of about 3 or 4, communication should be very tight. But when you get to 15, 20, 25 partners, it does take a lot more coordination and a lot more phone calls in order to make it really work. So I wanted to ask this last question here to the seasoned folks, and then of course those who have been doing coalition work for 1 year or more, you can answer as well. But for those who have a seasoned coalition, what advice do you have about maintaining engagement? How have you maintained engagement? I'm waiting for some more answers to come in. Did we lose some people? Okay, there you are. Calls, celebration, yes. Strategy meetings, absolutely. Great. Recognition of members, celebrating successes. Regular opportunities to learn and develop. That is very important. Thank you for saying that. I have also been involved in offering professional development opportunities through the coalition, and that could be absolutely focused on the goal of the coalition, just educating more about what the issue is, especially educating more about equity and how it impacts, and how our public health issues are multidimensional, and having those types of meetings in order to ensure that everyone, new members especially, are well informed about the issue. Regularly scheduled meetings at the same time, same place. I love that, because we need to have regularly scheduled meetings. Often it becomes very frustrating when at the end of a meeting, everyone get out your calendars. When are we going to meet? But rather, you know it's going to be the 4th Tuesday of every month. We are going to come together and solve this problem. Wonderful answers. Okay. So as you move forward, I wanted to provide you some resources. And you hear me talk a lot about collective impact just because, not that it's the best model, right? Not that it's the best model, but I love the elements of the model that it causes you to focus on, which are common agenda, everyone having the same vision, knowing, establishing leadership, having that backbone agency, establishing community engagement, which is important, and then also measuring, so measurement of your coalition. And measuring using that tracking software, because often we wait for the vital statistics to come out in order to have our measures, right, in order to make sure that we're reaching our goals. We wait for the mortality reports. We wait for the BRFSS. We wait for all of these tools to come out, but rather we need to be tracking, we need to track our progress in the project of it, right, in the process of it, and how we're doing. And so that's where the project tracking software comes from as well. We need to track if an agency has successfully changed the way that they do business in order to better serve people. We need to be able to track those outcomes and not just wait on statistics that we sometimes cannot prove are correlated with the work that we have done, okay? And so I provided a site there, and you will receive these slides after the webinar, and you will be able to click on these, but you can Google it as well. The collectiveimpactforum.org is one that I like more than another as far as providing resources, because they actually give you templates of how to run meetings to ensure that there is accountability and good communication. And then if you want to go more into coalitions and learning more about coalitions, because regardless of whether it's urban or rural, okay, we're all humans, and coalition building is really based on human development and how we operate as humans and interact. And so a great course is at University of Pennsylvania. It's actually a free online course that can give you a lot more about types of coalitions and more examples. Of course, they give a lot of political examples because coalition building was really focused within wartime, but rather it's still great examples if you want to go deeper into the theory of it. And then I also have my information available in case you need to contact me after this webinar. And then, of course, I have Trello.com and Basecamp.com as reminders of the types of project tracking software that your coalition might be interested in using as you track your progress. So are there any questions? And you can feel free to type them in as we have 10 minutes left. How do you get community members engaged? Thank you. Well, what we have done, or what I have done, is really focused on asking them, and some folks mention this, asking them first education about the issue. So it depends on what your issue is as well, because if it's smoking, you have a mighty hill to climb. However, if you know, if you're able to convey the benefits of the outcome, then you're able to get community members excited. So one is just asking them, actually being able to reach them and ask them, but being able to get them excited. So it's a matter of influence, and it's a matter of persuasion to get community members involved. And to be quite frank, provide lunch. Everyone comes for lunch. It does not have to be provided every time, but everyone comes for lunch. And actually you might have to shift your coalition meeting times because we often schedule them during the workday. And many parents, many community members are available after work hours. Scheduling a dinner, scheduling an after-hours meeting has also been beneficial in getting community members involved. The next question is, how do you find the community members when you are an institution going into a new community? So what I would do first is reach out and find the influencers within the community. That could be your community centers, ask your school system, ask your healthcare providers who the influencers are in the community, and they will name for you who in the neighborhood is the one person to go to that can get everybody on board. Who is the most popular that can be a spokesperson as long as we are talking to them and convincing them that the goal of our coalition will benefit them as well. So that's another way to do it, is to reach out to those institutions, those other institutions that are very popular and are wide used, and ask them who is the local leader that we should be speaking with. Another question is, how can I take my coalition from more than just an interagency meeting to a coalition doing activities in the community? So a lot of folks mentioned strategy meetings and development. I think those are two wonderful options. Actually hosting events for the community that educate about your issue. Because one thing is, some coalitions are just for program purposes, but those who are working at state and local and federal levels, you also have an element of public will that you need to build as you do your policy work. So you can't build public will if you're not in the community. So are you partnering with already established festivals? You know, we all have those festivals where everybody comes back home during the summer. We all have one. West Louisville Days is here in Louisville is what they have. And then I also know, I forget in Eastern Kentucky what it's called. But we all have those festivals where everybody comes back home. Those are absolutely perfect opportunities to have your coalition present. Have your coalition present and invite people to your meetings following up, because people do want to be involved. They just need to be asked. Work on social media. Make sure that your social media is hitting the target audiences that you need. If it's not Facebook, then it might be Instagram. If it's not Instagram, it just might be Snapchat. So be willing to stretch yourself to use forms of social media that also get the word out about what you are doing and inviting the community into your space. So do I have any examples of team building activities? So, you know, we often go to team building retreats and we spend thousands of dollars to tightrope walk and to fall in each other's arms. There's nothing wrong with that. There's nothing wrong with that. But there are smaller scale team building activities that you can do. And I'm actually going to share a few, now that you have submitted that, I'll share a few in the after webinar email correspondence that are called Cooperative Games that you can do within an office, okay, within an office space. And that you can do at the beginning of every coalition building meeting that you want to as well, and take very few supplies. But these cooperative games work on communication, they work on acceptance, they promote listening, and all of these different aspects of communication and conflict resolution and team building are incorporated into these games. And so your team can learn about each other and then learn how to work with each other through those short types of team building activities that you can include at your coalition meetings. So what advice do you have for a brand new coalition? What should be our first step? So your first step should really be to bring together the other agencies that share the same mission. Bring together agencies that share the same mission. Also think outside of the box about agencies that don't share the same mission. Remember the example about Baptists and Bootleggers? You would never think they'd get together, but they did. So think about other agencies that may have a different mission, but the goal is the same. Create a complementary group, okay, to come together, because you need the resources. The only reason I'm saying start with agencies is because you need the resources and you need the reach in order to then bring the community in. Make sure that your partners have a great reputation within the community. because that plays a huge part in building that public will. You know that they are accountable, you know that they are respected within community, and you know that they are valuable to the community. So those are 3 pieces to consider. In addition, within the link that, let me go back to the resources slide, in the collective impact link, they also have additional criteria to consider when bringing agencies into a coalition. So I'll be able to, you can search through that link, but I think I want to send you the direct link so you actually get to the resource that you need and that checklist that will help you through that. Well, we have 2 minutes left, Rochelle, and I don't see any more questions.
Wonderful. Thanks so much, Sivan. I love that we talked about coalition building today. We talked about tightrope walking. We talked about taking people seriously. Great ideas from you and from the group, so thank you everyone for participating today. If you're not already on the Foundation for Healthy Kentucky social media, I tweet out of Kentucky Health Facts. Healthy KY Twitter is the Foundation for Healthy Kentucky's Twitter. And if you go to our website, healthy-ky.org, you can sign up for our newsletter. I do have one announcement. The Foundation for Healthy Kentucky, in partnership with Kentucky Voices for Health and Caring Guidance, will be starting up a new coalition. The focus will be school health. And there is a meeting set for September 10th to get that school health coalition started. So just hot off the presses, the save the date has been announced, so I welcome you to join us there. I'm happy to give you additional information. Thanks everyone for joining us today. This afternoon I will send you an email with a post-event survey. I want to hear your feedback, what you enjoyed, and please suggest future topics for this series we fondly call Health for a Change. It's important for me to hear back from folks on what they're interested in doing. That's my little dog there that you see on the picture. Finally, I love to work with you. I'd love to see you in person at some of these coalition meetings across the state. I welcome your questions and comments directly to me. Thank you everyone for joining us today, and special thanks to you, Sivan, for sharing all your knowledge with us today. Thanks everyone. Have a great afternoon.